energy as we possibly can from foods and fluids. When an individual's really struggling to eat and drink, if they're missing out on a lot of the nutrition that they would normally get from the diet, then it might be that we use a nutritional supplement to replace some of those nutrients.
I first met the dietitian right before I started treatment. She was able to evaluate how many calories I might need all during treatment. The dietitian will try and plan it around you as an individual, and I had told her that I wasn't the best eater, so she gave me a prescription for calorie drinks.
One of the most common problems that people face is a poor appetite. And so we would often recommend that people eat small, frequent meals throughout the day with extra snacks and nourishing drinks. Other common problems such as a sore mouth or a dry mouth, people might find that the best way to overcome that is to go for soft, moist foods, avoiding really spicy foods or acidic fruit-based drinks. Another common problem is nausea. And sometimes people find that cold foods are often a little bit better than hot foods.
Find the foods you love and enjoy them while you can, because that might change, but it often is temporary. Listen to your dietitian, because what they're ultimately trying to do is not worry about your figure, but worry about your body.
When it comes to trying to improve your patient's caloric intake, you must first consider their diet order status. Are they NPO? Are they on a liquid diet? If the patient is NPO, advocate for the patient's diet to be advanced as soon as feasible. The same rule applies for that of a liquid diet, as it is impossible to obtain adequate nourishment under these diet order restrictions. When on a clear liquid diet, the most you can do is supplement. I found myself many times offering my oncology patients oral nutrition supplementation such as Ensure Plus, Ensure In Live, Ensure Compact, and Ensure Clear. For those on a clear liquid diet, Ensure Clear is the main option. In pediatrics, there are beverages such as Pediassure that are often recommended and easy to find at most supermarkets. Another roadblock in providing adequate nutrition to pediatric oncology patients is their interest in food. If a child's taste buds, sense of smell, and appetite have changed due to treatment, it is likely that their consumption will be reduced as a result. So how do we try to fix this? Well, there is no short, easy answer to this question. Each child is different and will present with different responses to these strategies you and their parents might attempt. What works for certain kids might not work as well for others, and vice versa. This is the part that got me interested in the field of dietetics, as my younger sister had cancer on and off throughout her life. As her big sister, I took on the role of trying to get her excited to eat. My personal and professional experiences have provided me with many ideas for improving intake. Before you attempt to offer or present food to the pediatric oncology patient, one must ensure that the patient is in a positive environment. Brighten your patient's mood or headspace as much as you can. Get to know your patient so that you are able to connect with them and make them feel comfortable around you. Now you can begin to introduce the idea of food. In the hospital, you are more limited to the resources one might have in the comfort of what they call their home. Some general examples include making the food look pretty. Arrange the food in an artsy way to draw their attention. Offer foods in pleasant or colorful packaging. Eat with them and express excitement for the foods and snacks. Watch shows or movies in which characters are eating together and have the patient eat at the same time, which a bonus point if that is a food from the show or movie, such as Ratatouille. Get them involved in ordering from the menu by presenting them with a colorful menu and reading it to them. Some other creative ideas for you as a dietitian to recommend to parents is to attempt a mealtime event. Play dress up and give your child the royal treatment. Princes and princesses gotta eat too, right? You can also encourage parents to allow their child to aid in food prep process. Let them mix the pasta sauce. Let them build their own tacos and sandwiches. Let them add toppings to the pizza or ice cream. Have them decorate desserts with you. If it's something they've made, they'll be more inclined to try it. Another thing you can recommend if feasible for the patient is to go on an adventure. Encourage the parental guardian to take their child to grocery stores, or better yet, the cider mill in fall time for some apple picking yummy treats. Other kid-friendly adventures with exciting foods include carnivals, the zoo, and maybe to parks for picnics when the weather's nice. But of course, during treatment, the patient's immune system is diminished, so ensure the patient and their guardian takes precaution, such as using hand sanitizer and wearing masks, as well as consulting with their doctor before going on these adventures. Another topic I would like to address is the myths presented to cancer patients about the diets to follow and foods to avoid. A common one I have heard is that sugar feeds cancer. Sugar feeds all cells in the body, including cancer cells. However, avoiding sugar will not significantly affect one's cancer development. In fact, a lack of sugar intake will prompt the body to create its own from glucose stores in fat tissue. Another myth is that a diet full of antioxidants and superfood will cure cancer. It is actually harmful to consume high antioxidant foods during chemotherapy, as it reduces its effectiveness in the body. It is important to keep our patients informed on the facts, as misinformation can be detrimental to their health. An unfortunate fact I would also like to bring to your attention is that much of the false information is produced for financial gain. Phrases such as cancer fighting or anti-cancer are thrown around without solid evidence to back these claims up. If you were to ever come across a patient or client that is adamantly following methods such as this, be sure to inform them that there is little evidence to prove or invalidate these claims. Further explain to them that more tests need to be run in order for there to be a true answer. In summary, the main takeaway of this presentation is that nutrition during childhood is critical for proper growth and development. For those diagnosed with various types of cancer, nutrition becomes more important to monitor. During treatment, malnourishment is quite common as a result of treatment. If the body is unable to heal as a result of poor nutrition, the length of hospital stays as well as rates of morbidity rise. The primary goal during treatment is to provide children as much nourishment as they are able to accept during their better days, as during bouts of extreme nausea or when having to be NPO for procedures. There's still much to study and to learn about medical nutrition and cancer, to further our understanding of the science of how the body and chemotherapy as well as cancerous cells react to various forms of nutrition therapy. Until then, we have this. Lastly, I would like to dedicate this to my sister Danielle, as she is my inspiration for going into dietetics with the goal of becoming a clinical dietitian in pediatric oncology. Thank you for viewing my presentation.